Question 1. The assessment process reveals a patient with erythematous patches and pseudomembranes on the dorsal surface of the tongue and buccal mucosa. The patient reports a history of recent antibiotic use and a feeling of oral dryness. Considering the differential diagnosis for oral lesions, which of the following diagnostic strategies is most appropriate for confirming a suspected fungal infection, specifically candidiasis in this scenario? Option A. Administer a systemic antifungal agent and obtain a complete blood count to assess for underlying systemic disease. Option B. Prescribe a broad-spectrum antifungal medication and monitor for symptom resolution. Option C. Perform a potassium hydroxide smear of a lesion scraping to visualize fungal hyphae and yeasts. Option D. Refer the patient to an oral surgeon for biopsy of the lesions without initial diagnostic testing. Correct answer is C. Perform a potassium hydroxide smear of a lesion scraping to visualize fungal hyphae and yeasts. Explanation. The assessment process reveals a patient presenting with oral lesions suggestive of a fungal infection. Differentiating between various fungal etiologies, particularly candidiasis, and understanding their potential systemic implications is crucial for accurate diagnosis and management. This scenario is professionally challenging because misdiagnosis can lead to delayed or inappropriate treatment, potentially worsening the patient's condition or leading to systemic spread. The dentist must apply a systematic approach to differential diagnosis, considering clinical presentation, patient history, and diagnostic aids. The correct approach involves a comprehensive clinical examination, detailed patient history including immunocompromise, medication use, and recent systemic illness, followed by appropriate diagnostic testing such as a potassium hydroxide, smear, or fungal culture. This aligns with the principles of evidence-based dentistry and the dentist's ethical obligation to provide competent care. The National Board Dental Examinations, NBDE. Part I assesses a candidate's ability to integrate foundational scientific knowledge with clinical application, ensuring they can make sound diagnostic and treatment decisions. An incorrect approach would be to rely solely on a presumptive diagnosis based on visual inspection without confirmatory testing. This fails to meet the standard of care and could lead to prescribing antifungal therapy for a non-fungal lesion, resulting in unnecessary drug exposure and potential side effects, and delaying treatment for the actual underlying condition. Another incorrect approach would be to ignore the possibility of systemic involvement in cases of severe or recurrent oral candidiasis, which could have serious health consequences for the patient, particularly if they are immunocompromised. This oversight represents a failure to consider the broader health of the patient and could be considered a breach of professional responsibility. Professionals should approach such situations by first gathering all relevant clinical information. This includes a thorough oral examination, palpation of lesions, and a detailed medical history. If a fungal infection is suspected, diagnostic confirmation is paramount. This might involve direct microscopy, KOH prep, for rapid identification of fungal elements, or sending samples for culture and sensitivity testing for definitive identification and susceptibility patterns. If systemic involvement is suspected, consultation with a physician is indicated. This systematic, evidence-based approach ensures accurate diagnosis, appropriate treatment, and patient safety, reflecting the core tenets of dental practice as tested by the NBDE Part I. Question 2. The risk matrix shows a high probability of neurological deficits following a specific type of spinal cord injury. A patient presents with loss of pain and temperature sensation on the left side of their body below the level of the lesion, and loss of voluntary motor control on the right side of their body below the lesion. Which of the following tracts is most likely to be primarily affected to produce this combination of deficits? Option A. Dorsal column medial lemniscus pathway. Option B. Corticospinal tract. Option C. Spinothalamic tract. Option D. Spinocerebellar tract. The correct answer is C. Spinothalamic tract. Explanation. This scenario presents a professional challenge because it requires the clinician to integrate knowledge of neuroanatomy with the potential for patient harm. The risk matrix highlights the importance of understanding the functional consequences of spinal cord lesions to anticipate and manage neurological deficits. Careful judgment is required to accurately diagnose the location and extent of the lesion, which directly impacts treatment planning and prognosis. The correct approach represents best professional practice because it demonstrates a thorough understanding of spinal cord tracts and their functions, aligning with the fundamental scientific knowledge expected of a dental professional. Accurately identifying the affected tracts allows for a precise prediction of sensory and motor deficits, which is crucial for patient management and communication. This aligns with the NBDE part as objective of assessing foundational biomedical sciences essential for safe and effective dental practice. An incorrect approach that misidentifies the affected tracts or their functions would represent a failure to meet the core competencies assessed by the NBDE Part I. This could lead to misdiagnosis, inappropriate treatment recommendations, and ultimately, patient harm. Ethically, failing to possess and apply this fundamental knowledge violates the principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Regulatory failure would stem from not demonstrating the required level of scientific understanding to practice dentistry competently. Professional reasoning process should involve a systematic approach. First, analyze the presented clinical signs and symptoms. Second, correlate these findings with known neuroanatomical pathways and their functions within the spinal cord. Third, consider differential diagnoses based on the potential lesion locations. And finally, select the most likely diagnosis that explains the observed deficits, demonstrating a clear understanding of the underlying pathophysiology. Question 3. Strategic planning requires a dentist to accurately diagnose and manage a patient presenting with a significant midline cleft of the palate that extends into the lip. Considering the embryological origins of such a defect, which of the following developmental processes, if disrupted, would most directly lead to this presentation? Option A. Failure of the medial nasal processes and maxillary processes to fuse properly during palate formation. Option B. A disruption in the dental lamina and subsequent tooth germ formation during the bud stage. Option C. Aberrant development of the lingual swellings leading to incomplete tongue fusion. Option D. Abnormal differentiation of ameloblasts and odontoblasts during enamel and dentin formation. The correct answer is A. Failure of the medial nasal processes and maxillary processes to fuse properly during palate formation. Explanation: scenario analysis. This scenario presents a professional challenge rooted in the critical need for accurate diagnosis and treatment planning during a patient's formative years. Understanding the embryological origins of craniofacial anomalies is paramount. Failure to correctly identify the developmental origin of a malocclusion or structural defect can lead to ineffective or even harmful interventions, impacting the patient's long-term oral health, function, and aesthetics. The dentist must integrate knowledge of normal development with the ability to recognize deviations. Correct approach analysis. The correct approach involves recognizing that a significant midline cleft of the palate, extending into the lip, is a complex developmental anomaly. This condition arises from the failure of the medial nasal processes and the maxillary processes to fuse properly during the embryonic period, typically around week 6-8 of gestation. Specifically, the primary palate, premaxilla, and secondary palate, hard and soft palate, formation are disrupted. The question probes the understanding of the embryological basis of such a defect, directly linking it to the failure of specific fusion events. This aligns with the NBDE part, as emphasis on foundational knowledge of oral and facial development, including the intricate processes of palate formation. Incorrect approach is analysis. One incorrect approach would be to attribute the midline cleft solely to a failure in tongue development. While tongue development is crucial for oral cavity formation, a midline cleft of the palate and lip is not a direct consequence of tongue malformation. Tongue development primarily involves the fusion of lingual swellings, and while it can influence palatal closure indirectly, it is not the primary embryological cause of a significant midline cleft. This misattribution demonstrates a fundamental misunderstanding of the specific developmental processes involved in palate formation. Another incorrect approach would be to link the condition to a problem in tooth development, such as the bud stage. Tooth development, while occurring concurrently with palatal formation, follows a distinct pathway involving the dental lamina and tooth germ. Anomalies at the bud stage typically manifest as missing teeth, supernumerary teeth, or malformed tooth crowns, not as large palatal or lip clefts. This incorrect association indicates a lack of clarity regarding the distinct embryological origins of different craniofacial structures. A further incorrect approach might suggest the issue stems from a problem with the enamel, dentin, cementum, or pulp formation. These components are integral to the mature tooth structure, and their development occurs after the initial formation of the tooth germ. Defects in these tissues result in structural weaknesses or abnormalities within the tooth itself, not in the gross anatomical formation of the palate or lip. This demonstrates a failure to differentiate between the development of the skeletal and soft tissue structures of the face and the development of the dental tissues. Professional reasoning. Professionals should employ a systematic approach to diagnosing craniofacial anomalies. This involves 1. Observing the clinical presentation, carefully noting the extent and location of any malformations. 2. Recalling foundational embryological knowledge, actively accessing and applying understanding of the developmental timelines and processes for all craniofacial structures. 3. Differentiating between developmental origins, distinguishing between anomalies arising from branchial arch defects, palate formation failures, tongue development issues, or tooth development problems. 4. Correlating clinical findings with embryological events, identifying which specific developmental failure best explains the observed anomaly. 5. Consulting resources if necessary, referring to textbooks or embryology atlases to confirm understanding. This structured reasoning ensures that diagnostic conclusions are based on sound scientific principles and lead to appropriate management strategies. Question 4. System analysis indicates a patient presence for a dental consultation requesting a specific cosmetic enhancement that involves altering the appearance of their gingival margin. During the clinical examination, you note a slight asymmetry in the alveolar bone contour adjacent to the area of concern, which is further visualized on a recently taken periapical radiograph. The radiograph clearly reveals a radiolucent area within the bone that is not immediately symptomatic but warrants further investigation. The patient is primarily focused on the aesthetic outcome and has not expressed any concerns about pain or discomfort. What is the most appropriate course of action for the dentist in this situation? Option A. Advise the patient to seek a second opinion from an oral surgeon without providing any specific details about the radiographic findings or their potential implications. Option B. Focus solely on addressing the patient's aesthetic concerns and assure them that the bone appears normal clinically, disregarding the radiographic finding. Option C. Proceed with the patient's requested cosmetic procedure as planned, as the radiolucent area is asymptomatic and not the patient's primary concern. Option D. Inform the patient about the radiographic finding of the radiolucent area. Explain its potential significance and the need for further diagnostic evaluation or treatment, and discuss how this might impact the planned cosmetic procedure. The correct answer is D. Inform the patient about the radiographic finding of the radiolucent area, explain its potential significance and the need for further diagnostic evaluation or treatment, and discuss how this might impact the planned cosmetic procedure. Explanation. Scenario analysis. This scenario presents an ethical dilemma concerning informed consent and the dentist's responsibility to provide comprehensive care, even when the patient's immediate request might not fully address underlying issues. The challenge lies in balancing patient autonomy with the dentist's professional obligation to diagnose and treat conditions that could impact oral health, particularly when those conditions involve other relevant tissues like bone. The dentist must navigate the patient's desire for a specific cosmetic outcome with the potential need for further investigation and treatment of a more serious underlying pathology. Correct approach analysis. The correct approach involves a thorough diagnostic process that extends beyond the patient's initial cosmetic concern. This includes a comprehensive examination of the bone supporting the teeth, utilizing radiographic imaging as indicated. If the radiographic findings suggest a pathology, the dentist has an ethical and professional obligation to inform the patient of these findings, explain their potential implications, and recommend further diagnostic steps or treatment. This aligns with the principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, by addressing potential health risks before they escalate. It also upholds the standard of care expected of a dental professional. Incorrect approaches analysis. One incorrect approach is to proceed solely with the patient's requested cosmetic procedure without investigating the radiographic findings. This fails to uphold the dentist's duty of care and could lead to significant harm if an underlying pathology is left untreated. It prioritizes a superficial outcome over the patient's overall health, violating the principle of beneficence. This also constitutes a failure to adhere to professional standards of diagnosis and treatment planning. Another incorrect approach is to dismiss the patient's concerns about the cosmetic aspect entirely and focus only on the potential bone pathology. While addressing the pathology is crucial, disregarding the patient's stated reason for seeking care can erode trust and lead to patient dissatisfaction, potentially causing them to seek care elsewhere without addressing the underlying issue. This approach neglects the principle of respect for patient autonomy and can be perceived as paternalistic. A third incorrect approach is to recommend a referral to a specialist without first performing a preliminary assessment and explaining the findings to the patient. While referral is often appropriate, the dentist has a responsibility to gather initial information and communicate it clearly. Failing to do so can leave the patient feeling uninformed and anxious about the referral, and it bypasses the dentist's role in initial diagnosis and patient education. Professional reasoning. Professionals should employ a systematic decision-making process that begins with active listening to the patient's chief complaint. This is followed by a comprehensive clinical examination, including appropriate diagnostic aids like radiographs. Any findings, whether related to the chief complaint or not, must be interpreted and communicated to the patient in a clear, understandable manner. The dentist should then discuss all viable treatment options, including risks, benefits, and alternatives, allowing the patient to make an informed decision. If further expertise is needed, a referral should be made with a clear explanation of why and what the specialist will address. Question 5. Market research demonstrates that dentists frequently encounter patients presenting with unilateral facial swelling and pain. A 45-year-old male presents with a 2-day history of progressive swelling and tenderness in the preauricular region, exacerbated by eating. He reports a low-grade fever. Upon palpation, the parotid gland is enlarged and firm, and purulent material can be expressed from Stenson's duct. Considering the anatomical structures and potential pathways of infection in this region, which of the following represents the most critical anatomical consideration for guiding the diagnostic and treatment approach in this patient? Option A. The lymphatic drainage of the mandible to the submandibular lymph nodes. Option B. The relationship of the parotid gland to the masseter muscle and the pterygoid venous plexus. Option C. The innervation of the temporalis muscle by the trigeminal nerve and its role in mastication. Option D. The course of the facial nerve through the parotid gland and its branches to the muscles of facial expression. The correct answer is B. The relationship of the parotid gland to the masseter muscle and the pterygoid venous plexus. Explanation. Scenario analysis. A dentist is presented with a patient exhibiting unilateral facial swelling and pain, suggestive of an infected parotid gland. The challenge lies in accurately diagnosing the source of the infection and understanding the anatomical relationships to avoid complications during treatment. Misidentification of the involved structures or facial spaces could lead to inadequate treatment, spread of infection, or damage to critical nerves and vessels, significantly impacting patient outcomes and potentially leading to malpractice claims. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's signs and symptoms, correlating them with the known anatomy of the head and neck, specifically focusing on the parotid gland, its ductal system, and surrounding facial planes. This includes considering the innervation of the parotid gland by the auriculopial nerve, a branch of the trigeminal nerve, and its vascular supply. Understanding the potential for infection to spread through facial spaces, such as the pterygomandibular space or the infratemporal fossa, is crucial for effective management. This aligns with the fundamental principles of dental practice, emphasizing accurate diagnosis and treatment planning based on comprehensive anatomical knowledge, as expected by the National Board Dental Examinations, NBDE, Part I, which assesses a dentist's foundational understanding of oral and maxillofacial anatomy and pathology. Incorrect approach is analysis, an approach that focuses solely on symptomatic relief without a thorough anatomical assessment risks overlooking the underlying cause and potential complications. For instance, prescribing antibiotics without considering the possibility of a sialolith obstructing the parotid duct would be a failure to address the root cause, potentially leading to recurrent infections or abscess formation. This demonstrates a lack of understanding of the functional anatomy of the salivary glands and their drainage pathways, a core competency tested by the NBDE Part I. Another incorrect approach would be to proceed with invasive procedures, such as incision and drainage, without a precise understanding of the facial planes and the proximity of vital structures like the facial nerve branches. Damage to the facial nerve would result in significant morbidity for the patient, representing a severe breach of professional duty and a failure to adhere to the standards of care assessed by the NBDE Part I. A third incorrect approach might involve misinterpreting the swelling as originating from a dental abscess in a nearby tooth, neglecting the possibility of parotid gland involvement. This diagnostic error stems from an incomplete consideration of differential diagnoses within the head and neck region, failing to integrate knowledge of both dental and salivary gland pathology, which is a critical aspect of the NBDE Part I curriculum. Professional reasoning. Professionals should employ a diagnostic framework that begins with a thorough patient history and clinical examination, followed by the application of anatomical knowledge to formulate a differential diagnosis. Imaging studies may be indicated to further delineate the extent of the pathology and its relationship to surrounding structures. Treatment planning should then be based on this comprehensive understanding, prioritizing patient safety and efficacy of care, in accordance with the rigorous standards set by the NBDE Part I. Question 6. Benchmark analysis indicates that a patient presents with symptoms of numbness and tingling in the hand, which the patient attributes to a recent dental procedure involving the mandibular nerve block. While the primary focus is on the oral cavity, a comprehensive understanding of the upper extremities' neurovascular structures is crucial for differential diagnosis. Which of the following anatomical considerations is most directly relevant to understanding potential nerve impingement or irritation that could manifest with such symptoms, even if the dental procedure itself was not directly targeting the hand? Option A. The course of the ulnar nerve as it passes through the cubital tunnel and its distribution to the hand. Option B. The anatomical course of the superficial peroneal nerve and its role in sensation to the dorsum of the foot. Option C. The origin and pathway of the brachial plexus and its terminal branches, including the median, ulnar, and radial nerves, as they innervate the upper limb. Option D. The relationship of the median nerve to the carpal tunnel and its branches supplying the hand. Correct answer is D. The relationship of the median nerve to the carpal tunnel and its branches supplying the hand. Explanation. This scenario presents a professional challenge due to the critical nature of accurately identifying anatomical structures, particularly neurovascular bundles, which are essential for safe and effective dental treatment. Misidentification can lead to iatrogenic injuries, patient harm, and potential legal ramifications. The dentist must rely on a robust understanding of anatomical variations and the ability to apply this knowledge in a clinical context. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established diagnostic and treatment protocols. A thorough understanding of the anatomy of the upper and lower extremities, including the precise location and course of major nerves and vessels, is fundamental to performing procedures that may involve these structures, even indirectly. This includes understanding potential variations that can occur. The dentist's responsibility is to ensure that their knowledge is current and applicable to clinical decision-making, thereby minimizing risks. This aligns with the ethical obligation to provide competent care and the regulatory expectation of maintaining professional standards. An incorrect approach that relies solely on rote memorization without understanding the clinical implications of anatomical variations is professionally unacceptable. This demonstrates a failure to apply knowledge effectively, potentially leading to diagnostic errors or inappropriate treatment planning. It also fails to acknowledge the dynamic nature of anatomy and the need for critical thinking in patient care. Another incorrect approach that neglects to consider the potential for referred pain or neurological symptoms originating from the extremities, even if the primary complaint is oral, is also professionally deficient. This indicates a lack of comprehensive patient assessment and a failure to consider the interconnectedness of the body systems. Such an oversight can lead to delayed or missed diagnoses of underlying conditions. Finally, an approach that dismisses patient-reported symptoms related to the extremities without a thorough anatomical and neurological evaluation is ethically problematic. This demonstrates a lack of empathy and a failure to uphold the duty of care. It can erode patient trust and lead to dissatisfaction with care. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review the patient's chief complaint and medical history, considering all potential contributing factors. 2. access and apply current knowledge of relevant anatomy, physiology, and pathology, including common variations. 3. Utilize appropriate diagnostic tools and techniques to gather objective data. 4. Formulate a differential diagnosis and develop a treatment plan that prioritizes patient safety and efficacy. 5. Continuously reassess the patient's condition and adjust the treatment plan as needed. Question 7. Process analysis reveals a patient presenting with sudden onset of unilateral facial weakness, affecting the entire side of the face including the forehead, accompanied by a loss of sensation over the ipsilateral cheek and anterior two-thirds of the tongue. The patient denies any other neurological symptoms. Which of the following diagnostic considerations is most critical for immediate dental management planning? Option A. Determining if the sensory loss is related to a local anesthetic administration error. Option B. Assessing the potential for a temporomandibular joint disorder to mimic facial weakness. Option C. Differentiating between a central nervous system lesion affecting the corticobulbar tract and a peripheral nervous system lesion of the facial nerve. Option D. Evaluating the patient's oral hygiene practices as a primary cause of facial discomfort. The correct answer is C. Differentiating between a central nervous system lesion affecting the corticobulbar tract and a peripheral nervous system lesion of the facial nerve. Explanation. Scenario analysis. A patient presents with unilateral facial weakness and sensory loss, raising immediate concern for a neurological deficit. Differentiating between a central nervous system lesion e.g. stroke affecting the corticobulbar tract and a peripheral nervous system lesion e.g. Bell's palsy affecting the facial nerve is critical for appropriate diagnosis and management. The challenge lies in accurately localizing the lesion based on the pattern of deficits, as misdiagnosis can lead to delayed or incorrect treatment, potentially worsening the patient's outcome. Correct approach analysis. The correct approach involves a systematic neurological examination focusing on the distribution of weakness and sensory deficits. For facial weakness, it is crucial to assess both the upper and lower face. Central lesions typically spare the forehead due to bilateral cortical innervation, while peripheral lesions cause weakness in the entire ipsilateral hemiface, including the forehead. Sensory deficits should be carefully mapped to cranial nerves or spinal dermatomes. This systematic approach aligns with the principles of differential diagnosis in neurology, emphasizing accurate localization as the cornerstone of effective patient care. The National Board Dental Examinations, NBDE. Part I assesses the foundational knowledge required for dentists to recognize and manage oral and maxillofacial conditions, including those with neurological origins that may impact dental treatment. Incorrect approaches analysis. One incorrect approach would be to solely focus on the dental implications without a thorough neurological assessment. This fails to recognize the potential severity of an underlying neurological condition and could lead to a delay in referral to appropriate medical specialists, violating the ethical obligation to act in the patient's best interest and potentially contravening guidelines regarding the scope of dental practice in recognizing systemic health issues. Another incorrect approach would be to prematurely diagnose a specific condition, such as Bell's palsy, without considering other possibilities like stroke or tumor. This premature closure of diagnosis, based on incomplete information, is a failure of critical thinking and can lead to inappropriate management. Ethically, it represents a deviation from the standard of care, which mandates a comprehensive evaluation before definitive conclusions are drawn. A third incorrect approach would be to dismiss the neurological symptoms as unrelated to the oral cavity or dental treatment, even if they are presenting concurrently. This demonstrates a lack of understanding of the interconnectedness of the body systems and the potential for neurological conditions to manifest with oral symptoms or to influence dental treatment planning. It neglects the dentist's responsibility to consider the patient's overall health. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a comprehensive history and physical examination, including a targeted neurological assessment when indicated. This involves forming a differential diagnosis, prioritizing potential causes based on prevalence and severity, and then utilizing diagnostic tools, e.g., further imaging, specialist consultation, to confirm or refute these hypotheses. The process emphasizes evidence-based practice, patient safety, and ethical considerations, ensuring that diagnostic and therapeutic decisions are well-informed and aligned with the best interests of the patient. Question 8. Quality control measures reveal an undocumented, significant developmental anomaly in a patient's historical dental records, suggesting a deviation from typical embryological development of a major organ system. The dentist must determine the most appropriate course of action. Option A. Conduct a thorough review of embryological literature to understand the anomaly, then discreetly and professionally communicate the findings and implications to the patient. Option B. Immediately inform the patient of the alarming finding without further investigation to ensure transparency. Option C. Alter the patient's record to reflect a less concerning interpretation of the anomaly to avoid patient distress. Option D. Ignore the finding, assuming it is an old, insignificant issue that has no bearing on current oral health. The correct answer is A. Conduct a thorough review of embryological literature to understand the anomaly, then discreetly and professionally communicate the findings and implications to the patient. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the ethical obligation to maintain patient confidentiality and the responsibility to ensure accurate and complete patient records. The dentist has discovered a significant developmental anomaly in a patient's dental records that was not previously identified or addressed. This anomaly, if left unaddressed, could have implications for the patient's oral health and potentially systemic health, given the interconnectedness of organ system development. The challenge lies in balancing the need to rectify the record and ensure proper patient care, with the potential for causing patient distress or violating privacy if the information is handled improperly. Correct approach analysis. The correct approach involves a thorough, evidence-based review of the patient's developmental history and the identified anomaly. This necessitates consulting relevant embryological and developmental biology literature to understand the origins and potential consequences of the anomaly. The dentist must then discreetly and professionally communicate their findings to the patient, explaining the nature of the anomaly, its developmental basis, and any potential implications for their current or future oral health. This approach upholds the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, by ensuring the patient is informed and can make decisions about their care. It also adheres to professional standards of record-keeping and patient communication. The NBDE Part I framework emphasizes a strong understanding of foundational biological sciences, including developmental biology, and their application to clinical practice. Incorrect approaches analysis. One incorrect approach would be to ignore the finding, assuming it is an old or insignificant issue. This fails to uphold the dentist's duty of care and could lead to missed diagnostic opportunities or inadequate treatment planning, violating the principle of beneficence. It also represents a failure in professional responsibility to maintain accurate and complete patient records. Another incorrect approach would be to immediately and without proper context or explanation inform the patient of a potentially alarming finding, causing undue anxiety. This violates the principle of non-maleficence by causing psychological harm and demonstrates a lack of professional communication skills, which are implicitly assessed through understanding patient management and ethical considerations in the NBDE Part I. A third incorrect approach would be to alter the patient's record to reflect a different, perhaps less concerning, interpretation of the developmental anomaly without a sound scientific basis or consultation. This constitutes falsification of records, a serious ethical and professional breach, and undermines the integrity of the patient's medical history, directly contradicting the principles of honesty and accuracy expected in dental practice and assessed in the NBDE Part I. Professional reasoning. Professionals facing such a situation should employ a systematic decision-making process. First, gather all relevant information and conduct a comprehensive review of the finding in light of established scientific knowledge. Second, assess the potential impact of the finding on the patient's health. Third, consult with colleagues or specialists if necessary. Fourth, develop a clear and empathetic communication plan for the patient, prioritizing their understanding and well-being. Finally, document all findings, discussions, and treatment decisions meticulously. This process ensures that decisions are evidence-based, ethically sound, and patient-centered, aligning with the core competencies assessed by the NBDE Part I. Question 9. Compliance review shows a patient presenting with unilateral facial numbness, weakness on the same side of the face, and a sensation of spinning vertigo. The patient also reports occasional ringing in the affected ear. based on the detailed study of cranial nerves I Roman 12, which cranial nerve S are most likely implicated, considering their origin, course, function, and potential clinical correlations in this presentation. Option A. Trigeminal nerve V for numbness, facial nerve Roman 7 for weakness, and vestibulocochlear nerve Roman 8 for vertigo and tinnitus. Option B. Olfactory nerve I for altered smell, and optic nerve Roman 2 for visual disturbances. Option C. Hypoglossal nerve Roman 12 for tongue deviation, and vagus nerve X for swallowing difficulties. Option D. Oculomotor nerve Roman 3 for ptosis, and trochlear nerve Roman 4 for diplopia. The correct answer is A. Trigeminal nerve V for numbness, facial nerve Roman 7 for weakness, and vestibulocochlear nerve Roman 8 for vertigo and tinnitus. Explanation. Scenario analysis. This scenario presents a professional challenge in diagnosing a patient with a constellation of symptoms that could be attributed to dysfunction of multiple cranial nerves. The challenge lies in accurately isolating the affected nerve, S, and understanding the functional deficits to formulate an appropriate treatment plan. Misinterpretation of the clinical findings can lead to delayed diagnosis, incorrect treatment, and potentially irreversible neurological damage, impacting patient outcomes and professional reputation. Correct approach analysis. The correct approach involves a systematic evaluation of each cranial nerve's function based on the patient's reported symptoms and observed signs. This aligns with the fundamental principles of neurological examination and diagnostic reasoning taught in dental education, which is the basis for the NBDE Part I. Specifically, correlating the patient's complaint of unilateral facial numbness and weakness with the sensory and motor components of the trigeminal nerve V and facial nerve Roman 7, respectively, and then considering the potential involvement of the vestibulocochlear nerve Roman 8 due to reported dizziness, demonstrates a thorough and logical diagnostic process. This systematic approach ensures that all potential causes are considered and that the diagnosis is based on objective findings and established neuroanatomy. Incorrect approaches analysis. One incorrect approach would be to focus solely on the most prominent symptom e.g., facial numbness, and immediately attribute it to a single nerve without considering other potential contributing factors or the interconnectedness of cranial nerve functions. This violates the principle of comprehensive patient assessment and can lead to a premature and inaccurate diagnosis, failing to address the full scope of the patient's condition. Ethically, this represents a failure to provide competent care. Another incorrect approach would be to dismiss the dizziness as unrelated to the facial symptoms, thereby neglecting the potential involvement of the vestibulocochlear nerve. This demonstrates a lack of understanding of the proximity and potential shared pathologies affecting cranial nerves in the head and neck region. It also fails to adhere to the expectation of a thorough neurological assessment. A third incorrect approach would be to rely on anecdotal evidence or non-standard diagnostic methods rather than established clinical correlations and neuroanatomical knowledge. This deviates from evidence-based practice and the rigorous standards expected of dental professionals, potentially leading to misdiagnosis and inappropriate management. Professional reasoning. Professionals should approach such cases by first eliciting a detailed history of the symptoms, including onset, duration, character, and aggravating/alleviating factors. This should be followed by a systematic physical examination, focusing on the specific functions of each cranial nerve relevant to the reported symptoms. This includes testing sensory perception, motor function, special senses, vision, hearing, taste, and balance. The findings from the history and physical examination should then be integrated with knowledge of cranial nerve anatomy and physiology to formulate a differential diagnosis. This systematic, evidence-based approach ensures accurate diagnosis and effective patient management. Question 10. Assessment of a patient presenting with generalized gingival inflammation, increased probing depths, and slight tooth mobility requires a thorough evaluation of the oral tissues. Which of the following diagnostic approaches best integrates the assessment of epithelial and connective tissues of the gingiva with the underlying periodontal structures to determine the extent of disease and guide treatment? Option A. Relying solely on the patient's description of discomfort and tooth mobility to initiate treatment. Option B. Performing immediate surgical intervention to address the perceived inflammation without further diagnostic steps. Option C. A comprehensive clinical examination including visual inspection, palpation, periodontal probing, and radiographic assessment of alveolar bone. Option D. Prescribing broad-spectrum antibiotics to manage the gingival inflammation without a detailed clinical assessment. The correct answer is C. A comprehensive clinical examination including visual inspection, palpation, periodontal probing, and radiographic assessment of alveolar bone. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the dentist to accurately assess the health of oral tissues, specifically the gingiva and underlying alveolar bone, determine the appropriate treatment plan for a patient experiencing discomfort and mobility. Misinterpreting the extent of periodontal disease or failing to recognize early signs of bone loss can lead to delayed or inadequate treatment, potentially resulting in irreversible damage and tooth loss. The dentist must integrate knowledge of epithelial and connective tissue characteristics, along with the structural components of the periodontium, to make a sound clinical judgment. Correct approach analysis. The correct approach involves a comprehensive clinical examination that includes visual inspection, palpation, and probing of the gingival tissues, as well as radiographic assessment to evaluate the alveolar bone. This systematic approach allows for the identification of inflammation, pocket depth, recession, and bone loss, which are critical indicators of periodontal health. By correlating clinical findings with radiographic evidence, the dentist can accurately diagnose the stage and severity of periodontal disease, thereby formulating an evidence-based and effective treatment plan that aligns with the principles of patient care and professional responsibility as outlined by dental practice standards. Incorrect approaches analysis. One incorrect approach would be to rely solely on patient-reported symptoms without a thorough clinical and radiographic examination. This fails to meet the standard of care by neglecting objective diagnostic measures, potentially leading to a misdiagnosis or underestimation of the disease severity. Ethically, this approach breaches the duty to provide competent care and could be considered negligent. Another incorrect approach would be to initiate aggressive surgical intervention without first attempting less invasive periodontal therapy, such as scaling and root planing. This is not risk-assessed and could lead to unnecessary patient discomfort, increased costs, and potential complications without a clear indication of its necessity based on a comprehensive diagnosis. This deviates from the principle of providing the least harmful effective treatment. A further incorrect approach would be to dismiss the patient's symptoms as minor irritation without investigating further, especially if there are subtle signs of gingival changes or early bone loss. This demonstrates a lack of diligence and could result in the progression of periodontal disease, leading to more severe consequences for the patient. This failure to investigate thoroughly compromises patient well-being and professional accountability. Professional reasoning. Professionals should approach such situations with a systematic diagnostic process. This involves gathering subjective information, patient history and symptoms, followed by objective clinical examination, visual inspection, palpation, probing, and then diagnostic aids, radiographs, vitality tests, etc. The findings from each step are integrated to form a differential diagnosis, which is then refined into a definitive diagnosis. Treatment planning should be based on this diagnosis, considering the least invasive yet most effective options, and always prioritizing patient safety and well-being. Regular reevaluation and patient education are integral to ongoing care. Question 11. Comparative studies suggest that certain anesthetic agents used in dental procedures can significantly alter the body's normal mechanisms for regulating breathing. A patient undergoing a complex oral surgery requires general anesthesia. The anesthesiologist notes a decrease in the patient's tidal volume and an increase in the partial pressure of carbon dioxide in the arterial blood, PaCO2, during the procedure. Which of the following physiological responses is most likely contributing to this observed change in gas exchange and respiratory regulation? Option A. Enhanced diffusion of oxygen across the alveolar capillary membrane due to the anesthetic's vasodilatory effects. Option B. Depression of the medullary respiratory centers by the anesthetic agent, reducing the drive to breathe and thus decreasing tidal volume. Option C. Increased sensitivity of the peripheral chemoreceptors to changes in PaCO2, leading to a compensatory increase in respiratory rate. Option D. Increased functional residual capacity, FRC, caused by the anesthetic, which would typically improve gas exchange. The correct answer is C. increased sensitivity of the peripheral chemoreceptors to changes in PaCO2, leading to a compensatory increase in respiratory rate. Explanation: this scenario presents a professional challenge because a dentist must interpret complex physiological data to ensure patient safety during a procedure that may impact respiratory function. The dentist needs to apply knowledge of gas exchange principles, lung volumes, and the regulation of respiration to make informed decisions about anesthetic management and patient monitoring. This requires more than rote memorization. It demands the ability to synthesize information and apply it to a clinical context, adhering to established standards of care. The correct approach represents best professional practice because it prioritizes patient well-being by accurately assessing the patient's respiratory status and potential risks. This aligns with the fundamental ethical and professional obligation of dentists to provide safe and effective care. Specifically, understanding how anesthetic agents affect respiratory drive and gas exchange allows for appropriate adjustments in anesthetic depth and ventilatory support, minimizing the risk of hypoxemia or hypercapnia. This proactive approach is consistent with the principles of prudent medical practice and the implicit duty of care expected of all healthcare providers. An incorrect approach that focuses solely on the patient's subjective comfort without objectively assessing respiratory parameters would be a regulatory and ethical failure. This would violate the dentist's duty to monitor vital signs and assess physiological status, potentially leading to undetected respiratory compromise. Another incorrect approach, such as assuming normal respiratory function based on preoperative assessment alone, ignores the dynamic nature of physiological responses during anesthesia and procedure, failing to meet the standard of continuous patient monitoring and risk management. A third incorrect approach, relying on outdated or unverified information regarding anesthetic effects on respiration, would represent a failure to maintain professional competence and adhere to current best practices, which is a violation of professional conduct guidelines. A professional decision-making process for similar situations should involve a systematic assessment of the patient's baseline respiratory status, understanding the physiological effects of the planned anesthetic and surgical interventions on gas exchange and respiratory control, and implementing appropriate monitoring strategies. This includes continuous evaluation of oxygen saturation, end-tidal carbon dioxide levels, respiratory rate, and depth, and being prepared to intervene promptly if any deviations from normal are detected. This process is guided by evidence-based practice and the ethical imperative to act in the patient's best interest. Question 12. The efficiency study reveals that a dental professional is evaluating a patient presenting with persistent, diffuse abdominal discomfort that is not clearly localized. The professional needs to consider potential referred pain patterns or systemic conditions that might manifest orally. Which of the following anatomical relationships within the abdominal cavity is most critical for understanding potential connections to oral health issues in this context? Option A, the superficial musculature of the anterior abdominal wall and its innervation. Option B, the relative positions of the stomach, liver, spleen, and pancreas to each other and their proximity to the diaphragm. Option C, the anatomical boundaries of the thoracic cavity and its major organs. Option D, the detailed vascular supply of the lower extremities. The correct answer is B, the relative positions of the stomach, liver, spleen, and pancreas to each other, and their proximity to the diaphragm. Explanation: scenario analysis. This scenario presents a challenge in a clinical setting where a dental professional must accurately identify anatomical structures within the abdominal cavity to understand potential referred pain or systemic implications of oral conditions. Misidentification can lead to incorrect diagnosis, inappropriate treatment plans, and failure to recognize serious underlying health issues, impacting patient safety and care quality. Correct approach analysis. The correct approach involves a thorough understanding of the anatomical relationships within the abdominal cavity, specifically the location and function of the stomach, liver, spleen, and pancreas. This knowledge is fundamental for a dental professional to correlate oral findings with potential systemic health issues, aligning with the ethical obligation to provide comprehensive patient care and the regulatory requirement to maintain a high standard of professional practice, as outlined by the NBDE Part I framework, which assesses foundational biomedical and dental sciences. Incorrect approaches analysis. One incorrect approach would be to focus solely on superficial anatomical landmarks without understanding the deeper visceral relationships. This fails to meet the NBDE part as requirement for understanding the functional anatomy of major organ systems and their relevance to oral health. Ethically, it represents a lapse in due diligence and a failure to provide thorough patient assessment. Another incorrect approach is to prioritize knowledge of structures in other body cavities over the abdominal cavity, when the clinical presentation suggests a potential abdominal connection. This demonstrates a lack of comprehensive anatomical knowledge, a core competency assessed by the NBDE Part I, and could lead to overlooking critical diagnostic information, violating the principle of providing competent care. A third incorrect approach is to rely on generalized anatomical descriptions without considering the specific anatomical variations that can occur or the precise spatial relationships between organs. This superficial understanding is insufficient for accurate clinical correlation and falls short of the detailed anatomical knowledge expected for safe and effective dental practice, as mandated by the NBDE Part I's assessment objectives. Professional reasoning. Professionals should employ a systematic approach to anatomical recall, starting with the major quadrants and regions of the abdomen, then identifying the primary organs within each. This should be followed by understanding the vascular supply, innervation, and lymphatic drainage, and critically, the functional interrelationships between these organs and their potential impact on oral health. This structured recall and application process ensures a comprehensive understanding, enabling accurate clinical correlation and adherence to professional standards. Question 13. To address the challenge of managing a patient with a history of hypertension and angina during a routine dental extraction, which of the following physiological considerations is most critical for the dentist to prioritize to prevent adverse cardiovascular events? Option A. The likelihood of postoperative edema and its effect on local tissue perfusion. Option B. The potential for vasodilation induced by certain anesthetic agents, leading to a drop in blood pressure. Option C. The impact of sympathetic nervous system activation on heart rate and blood pressure, potentially precipitating an anginal episode or myocardial infarction. Option D. The risk of reflex bradycardia secondary to baroreceptor stimulation from pain or anxiety. The correct answer is B. The potential for vasodilation induced by certain anesthetic agents, leading to a drop in blood pressure. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for significant patient harm if cardiovascular physiological responses are not accurately understood and managed during a dental procedure. The dentist must anticipate and respond to physiological changes that can be exacerbated by patient anxiety, local anesthetics, and the stress of dental treatment. Failure to recognize and appropriately manage these changes can lead to adverse events, including syncope, arrhythmias, or even myocardial infarction, particularly in patients with pre-existing cardiovascular conditions. The dentist's judgment is critical in assessing risk and implementing preventative and responsive measures. Correct approach analysis. The correct approach involves a thorough preoperative assessment to identify patients at risk for cardiovascular compromise. This includes a detailed medical history, vital signs measurement, and consideration of the patient's anxiety level. During the procedure, continuous monitoring of vital signs and close observation for signs of distress are paramount. The dentist must be prepared to manage potential complications, such as administering oxygen, having emergency medications readily available, and knowing when to terminate the procedure and seek immediate medical assistance. This approach aligns with the fundamental ethical obligation of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as the general standard of care expected of a dental professional in the United States, as guided by the American Dental Association's principles of ethics and practice. Incorrect approach is analysis. One incorrect approach would be to proceed with treatment without a comprehensive preoperative cardiovascular risk assessment, assuming all patients will tolerate the procedure without issue. This violates the principle of non-maleficence by failing to proactively identify and mitigate potential risks. It also disregards the professional responsibility to practice within the scope of one's knowledge and ability, which includes understanding the physiological impact of dental procedures on the cardiovascular system. Another incorrect approach would be to administer local anesthetics containing vasoconstrictors without considering the patient's cardiovascular status or potential contraindications. Vasoconstrictors can increase heart rate and blood pressure, which can be dangerous for individuals with certain cardiac conditions. This action demonstrates a failure to apply knowledge of pharmacology and physiology in a clinically relevant manner, potentially leading to iatrogenic harm. A third incorrect approach would be to ignore or dismiss signs of patient distress, such as pallor, diaphoresis, or changes in breathing rate during the procedure. This demonstrates a lack of vigilance and a failure to respond appropriately to physiological indicators of compromise, directly contravening the duty to monitor and protect the patient's well-being. Such negligence can have severe consequences and represents a breach of professional responsibility. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment. This includes gathering information about the patient's medical history, current medications, and any known cardiovascular conditions. Next, the dentist should evaluate the potential risks associated with the planned dental procedure, considering the type of procedure, the duration, and the patient's overall health status. Based on this risk assessment, appropriate preventative measures should be implemented, such as pre-medication for anxiety, careful selection of anesthetic agents, and modifications to the treatment plan. During the procedure, continuous monitoring of the patient's vital signs and observation for any signs of distress are essential. Finally, the dentist must have a clear emergency preparedness plan, including knowledge of emergency protocols and the availability of necessary equipment and medications to respond effectively to any adverse events. This comprehensive approach ensures patient safety and upholds the highest standards of professional practice. Question 14. Quality control measures reveal a patient presenting with new-onset unilateral facial numbness and difficulty initiating masticatory movements following a complex mandibular third molar extraction. Based on the neuroanatomical structures most directly involved in relaying sensory information from the face and controlling muscles of mastication, which of the following brain regions is most likely implicated in these symptoms? Option A, cerebellum. Option B, diencephalon. Option C, cerebral cortex. Option D, brainstem. The correct answer is D, brainstem. Explanation. This scenario presents a professional challenge because it requires a dentist to integrate knowledge of neuroanatomy with the potential impact of a dental procedure on a patient's neurological function. The challenge lies in accurately identifying the brain region most likely affected by a specific dental intervention and understanding the functional consequences of that impact, all within the scope of dental practice as defined by the National Board Dental Examinations, NBDE, Part I. Careful judgment is required to avoid misinterpreting symptoms or recommending inappropriate interventions. The correct approach represents best professional practice because it demonstrates a thorough understanding of neuroanatomy and its relevance to dental procedures. Aligning with the NBDE Part I's assessment of foundational scientific knowledge essential for safe and effective dental care. Specifically, it correctly links the potential for altered sensation or motor control in the facial region to the involvement of the brainstem, which houses cranial nerve nuclei critical for these functions. This understanding is crucial for diagnosing and managing potential complications arising from dental treatments, ensuring patient safety and adherence to the principles of ethical dental practice. An incorrect approach that misidentifies the primary brain region involved would represent a failure to meet the foundational scientific knowledge standards assessed by the NBDE Part I. For instance, attributing a specific neurological deficit solely to the cerebral cortex without considering the brainstem's role in relaying sensory and motor information would be a significant oversight. This could lead to misdiagnosis, delayed or incorrect treatment, and potentially harm to the patient. Such an error would violate the ethical obligation to provide competent care based on accurate knowledge. Another incorrect approach might involve overemphasizing the role of the cerebellum in this specific context, as its primary functions relate to coordination and balance, not direct sensory or motor control of the face in the way the brainstem does. This would also indicate a gap in fundamental neuroanatomical understanding. The professional reasoning process for similar situations should involve a systematic approach. First, thoroughly assess the patient's presenting symptoms and relate them to known neurological pathways and functions. Second, consider the dental procedure performed and its potential proximity or impact on relevant anatomical structures. Third, consult reliable neuroanatomical resources to confirm the most likely affected brain region and its functional significance. Finally, integrate this knowledge with clinical findings to formulate a differential diagnosis and appropriate management plan, always prioritizing patient safety and adhering to the scope of dental practice. Question 15. The monitoring system demonstrates a patient presenting with a significantly reduced salivary flow rate and an increased viscosity of the collected saliva. Further analysis reveals that the submandibular and sublingual glands are contributing disproportionately to this observed change. Based on the histological structure and functional characteristics of these salivary glands, which of the following is the most likely primary cellular dysfunction? Option A. A generalized decrease in the total volume of saliva produced without a significant alteration in its viscosity. Option B. A systemic autoimmune response solely targeting the parotid gland serous cells. Option C. Primary dysfunction of the parotid gland serous acinar cells, resulting in a generalized decrease in saliva volume. Option D. Impaired function of serous acinar cells and mucous acinar cells within the submandibular and sublingual glands, leading to a decrease in watery, enzyme-rich secretions and an increase in mucin-rich secretions. The correct answer is D. Impaired function of serous acinar cells and mucous acinar cells within the submandibular and sublingual glands, leading to a decrease in watery, enzyme-rich secretions and an increase in mucin-rich secretions. Explanation. Scenario analysis. This scenario presents a challenge because it requires the dental professional to interpret physiological data related to salivary gland function and correlate it with potential underlying causes. The difficulty lies in distinguishing between normal variations and pathological indicators, necessitating a thorough understanding of salivary gland histology and physiology as tested by the NBDE Part I. Correct approach analysis. The correct approach involves recognizing that a reduced flow of viscous saliva, particularly from the submandibular and sublingual glands, points towards a functional impairment of mucus cells and slash or serous demolunes within these mixed glands. This aligns with the NBDE Part I's emphasis on understanding the cellular composition and secretory products of different salivary gland types. The submandibular gland, being predominantly serous but with significant mucus components, and the sublingual gland being mixed with a higher proportion of mucus acini, are key to this interpretation. A decrease in the watery, enzyme-rich component serous and an increase in the thicker, mucin-rich component mucus would manifest as reduced flow and increased viscosity. This understanding is fundamental to diagnosing conditions affecting salivary gland function, a core competency assessed by the exam. Incorrect approaches analysis. One incorrect approach would be to attribute the findings solely to a problem with the parotid gland. The parotid gland is primarily a serous gland, and while its dysfunction can affect saliva composition, a significant reduction in viscosity and flow, especially when considering the contribution of submandibular and sublingual glands, is less likely to be exclusively parotid-related. This demonstrates a failure to accurately recall the histological and functional differences between major salivary glands, a key area of NBDE Part I assessment. Another incorrect approach would be to focus only on the total volume of saliva without considering its viscosity. Salivary gland function is not solely about quantity, but also quality, composition, and viscosity. Ignoring viscosity would lead to an incomplete diagnostic picture and a misunderstanding of the underlying physiological processes. This reflects a superficial understanding of salivary gland function, failing to grasp the interplay between serous and mucus secretions. A third incorrect approach would be to assume the findings indicate a systemic autoimmune disease without further investigation. While certain autoimmune conditions can affect salivary glands, the initial interpretation should be based on the direct physiological observations of saliva characteristics and the known functions of the specific glands involved. Jumping to a systemic diagnosis without considering localized glandular pathology demonstrates a lack of systematic diagnostic reasoning, which is crucial for dental professionals and is implicitly tested by the NBDE Part I's focus on foundational sciences. Professional reasoning. The professional decision-making process in such a scenario begins with a thorough review of the presented physiological data. This involves recalling the histological structure and functional contributions of each salivary gland type, serous, mucus, mixed, and their respective secretory products. The next step is to correlate the observed symptoms, reduced flow, increased viscosity, with the known functions of the affected glands. This deductive reasoning allows for the identification of the most probable underlying cause. Finally, this initial assessment guides further diagnostic steps, such as specific clinical examinations or laboratory tests, to confirm the diagnosis and formulate an appropriate treatment plan. This systematic approach ensures that conclusions are evidence-based and grounded in fundamental scientific principles. Question 16. Governance review demonstrates a patient reporting persistent altered sensation in the lower lip and chin area following a routine mandibular molar extraction. The patient describes a tingling and numbness that has not fully resolved after several weeks. Considering the neurophysiological principles assessed in the National Board Dental Examinations, NBDE Part I, which of the following diagnostic and management strategies best reflects a systematic and evidence-based approach to this clinical presentation? Option A. Advise the patient that such sensations are common after extractions and will likely resolve spontaneously within a few months, recommending no further investigation. Option B. Immediately prescribe a course of high-dose corticosteroids to reduce potential inflammation around the nerve. Without further diagnostic testing, Option C. Focus solely on managing the patient's pain with analgesics, assuming the sensory alteration is a secondary symptom of residual inflammation. Option D. Perform a detailed sensory examination of the affected area, including testing for light touch, pinprick, and proprioception, and correlate findings with the anatomical distribution of the inferior alveolar nerve and its branches. The correct answer is D. Perform a detailed sensory examination of the affected area, including testing for light touch, pinprick, and proprioception, and correlate findings with the anatomical distribution of the inferior alveolar nerve and its branches. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient reports a specific sensory deficit following a dental procedure. Dentists must accurately diagnose the cause of the altered sensation, which requires a thorough understanding of neuroanatomy and neurophysiology, specifically the pathways involved in sensory perception and the potential iatrogenic effects of dental interventions. The challenge lies in differentiating between temporary nerve irritation, more significant nerve damage, and other potential etiologies, all while managing patient expectations and ensuring appropriate treatment. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's symptoms, correlating them with the anatomical structures affected by the dental procedure. This includes understanding how local anesthetics can temporarily or permanently affect nerve function, how surgical trauma can lead to nerve injury, and how the nervous system regenerates or adapts. Best professional practice dictates a thorough history, clinical examination, and potentially diagnostic tests to pinpoint the affected nerve and the extent of the injury. This aligns with the ethical obligation to provide competent care and to minimize harm. The NBDE Part I curriculum emphasizes these foundational principles of neurobiology, which are directly applicable to diagnosing and managing such clinical presentations. Incorrect approach is analysis. One incorrect approach would be to dismiss the patient's complaint without a proper investigation, assuming it is a transient side effect that will resolve on its own. This fails to uphold the professional duty of care and could lead to delayed diagnosis and treatment of a more serious condition. Ethically, it demonstrates a lack of patient-centeredness and a disregard for the patient's reported experience. Another incorrect approach would be to immediately attribute the symptom to irreversible nerve damage without considering less severe possibilities or conducting a comprehensive assessment. This could lead to unnecessary patient anxiety and potentially inappropriate or overly aggressive treatment plans. It also fails to adhere to the principle of evidence-based practice, which requires a thorough diagnostic process. A third incorrect approach might involve recommending a treatment that is not directly supported by the diagnostic findings or that carries significant risks without clear justification. This could involve prescribing medications or suggesting interventions without a clear understanding of the underlying neurophysiological cause, potentially causing further harm or failing to address the root of the problem. This violates the principle of beneficence and non-maleficence. Professional reasoning. Professionals should approach such situations by first acknowledging and validating the patient's reported symptoms. A systematic diagnostic process, grounded in the foundational knowledge tested by the NBDE Part I, is crucial. This involves 1. Detailed history taking, including the specifics of the dental procedure and the onset/nature of the sensory changes. 2. A comprehensive clinical examination, including sensory testing of the affected area. 3. Correlating findings with neuroanatomy and neurophysiology to identify potential nerve involvement. And 4. Developing a treatment plan based on the most probable diagnosis, which may include observation, conservative management, or referral if necessary. This structured approach ensures patient safety, promotes effective treatment, and upholds professional standards. Question 17. Consider a scenario where a patient presents with generalized muscle weakness and fatigue, which is exacerbated after periods of exertion. Laboratory tests reveal an elevated serum potassium level. Based on your understanding of cellular physiology, which of the following cellular mechanisms is most likely contributing to the patient's symptoms? Option A. Overactivation of voltage-gated calcium channels, resulting in excessive calcium influx and uncontrolled muscle contraction. Option B. Impaired function of the sodium-potassium at pace pump, leading to altered resting membrane potential and reduced excitability of muscle cells. Option C. Increased permeability of the sarcoma to chloride ions, leading to hyperpolarization and decreased muscle cell excitability. Option D. Reduced activity of voltage-gated sodium channels, causing a diminished action potential amplitude and impaired muscle fiber depolarization. The correct answer is B. Impaired function of the sodium-potassium at pace pump, leading to altered resting membrane potential and reduced excitability of muscle cells. Explanation. This scenario presents a professional challenge because it requires the dentist to apply fundamental cellular physiology principles to a clinical situation involving a patient's compromised cellular function. The dentist must accurately identify the underlying cellular mechanism affecting the patient's response to treatment and select an appropriate management strategy based on this understanding. Careful judgment is required to differentiate between various cellular processes and their clinical manifestations. The correct approach represents best professional practice because it directly addresses the root cause of the patient's condition by understanding the cellular dysfunction. This aligns with the ethical obligation to provide evidence-based care and to act in the patient's best interest. By recognizing the impaired sodium-potassium pump activity and its impact on membrane potential and cellular homeostases, the dentist can make informed decisions about treatment modifications or supportive care that are physiologically sound and likely to be effective. This approach prioritizes patient safety and optimal outcomes by grounding clinical decisions in scientific understanding. An incorrect approach that focuses solely on symptomatic relief without addressing the underlying cellular deficit fails to provide comprehensive care. This could lead to suboptimal treatment outcomes or mask a worsening condition, potentially violating the principle of beneficence. Another incorrect approach that misinterprets the cellular mechanism, for example, by attributing the symptoms to a different ion channel dysfunction, would lead to inappropriate treatment strategies, potentially causing harm and violating the principle of non-maleficence. A third incorrect approach that ignores the cellular basis and relies on anecdotal evidence or unverified treatments would be professionally negligent and deviate from established scientific standards of care, potentially violating professional conduct guidelines. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly assess the patient's signs and symptoms. Second, formulate a differential diagnosis based on clinical presentation and relevant scientific knowledge, including cellular physiology. Third, gather further information through diagnostic tests if necessary. Fourth, select a treatment plan that directly addresses the identified cause, prioritizing interventions supported by scientific evidence and ethical principles. And finally, monitor the patient's response and adjust the treatment plan as needed. This iterative process ensures that clinical decisions are informed, patient-centered, and ethically sound. Question 18. The investigation demonstrates that a dental abscess in the posterior mandible can potentially lead to complications affecting intracranial structures. Which of the following venous drainage pathways is most critical to consider when assessing the risk of retrograde spread of infection from the oral cavity to the cavernous sinus? Option A. The superior ophthalmic vein draining into the cavernous sinus. Option B. The pterygoid plexus draining into the cavernous sinus via emissary veins. Option C. The pterygoid plexus draining into the retromandibular vein. Option D. the facial vein draining into the anterior facial vein. The correct answer is C, the pterygoid plexus draining into the retromandibular vein. Explanation: scenario analysis. This scenario presents a challenge for a dental professional because it requires understanding the intricate neurovascular supply to the brain, specifically the venous drainage. A dental procedure, even one seemingly distant from the brain, can have implications if complications arise, such as infection spreading through venous pathways. The professional must possess a thorough knowledge of these structures to anticipate potential risks and manage complications effectively, ensuring patient safety. Correct approach analysis. The correct approach involves accurately identifying the venous drainage pathways from the oral and maxillofacial regions to the intracranial venous sinuses. This knowledge is crucial for understanding how infections or emboli could potentially spread. Best professional practice, as guided by the principles of patient care and the ethical obligations inherent in dental practice within the U.S. regulatory framework, mandates a comprehensive understanding of anatomy and physiology to prevent harm and manage complications. This aligns with the general duty of care expected of all healthcare professionals. Incorrect approach is analysis. An incorrect approach would be to underestimate the interconnectedness of the venous system. For instance, assuming that venous drainage from the face and oral cavity does not directly or indirectly communicate with the cavernous sinus would be a significant anatomical and clinical error. This oversight could lead to misdiagnosis or delayed treatment of serious conditions like cavernous sinus thrombosis, a potentially life-threatening complication. Such a failure to recognize anatomical relationships would represent a breach of the standard of care and could be considered professional negligence under U.S. dental practice laws. Another incorrect approach would be to focus solely on arterial supply without considering the critical role of venous drainage in the spread of infection or emboli, which is equally important for patient safety. Professional reasoning. Professionals should approach patient care with a commitment to continuous learning and a thorough understanding of relevant anatomy and physiology. When faced with procedures that could potentially impact neurovascular structures, a systematic approach is necessary. This involves 1. Recalling and applying anatomical knowledge of both arterial and venous systems. 2. Considering potential complications and their pathways of spread. 3. Prioritizing patient safety by understanding the risks associated with the chosen treatment. 4. Consulting relevant literature or colleagues if uncertainty exists. This decision-making process ensures that patient care is evidence-based and adheres to the highest professional standards. Question 19. Upon reviewing a patient's laboratory results, you note elevated blood glucose levels and a concurrent decrease in serum calcium. Considering the major endocrine glands and their hormonal products, which of the following hormones, synthesized and secreted in response to specific physiological stimuli, is most likely responsible for both of these observed metabolic changes? Option A, cortisol. Option B, parathyroid hormone. Option C, glucagon. Option D, insulin. The correct answer is C, glucagon. Explanation. This scenario presents a professional challenge due to the need to differentiate between the physiological effects of two distinct endocrine hormones on a common target tissue, requiring a nuanced understanding of their synthesis, secretion, and action mechanisms. Careful judgment is required to accurately identify the hormone responsible for the observed changes, which directly impacts diagnosis and treatment planning. The correct approach represents best professional practice because it accurately identifies the hormone based on its specific synthesis pathway and receptor interaction, aligning with the foundational scientific principles tested by the NBDE Part I. This ensures that diagnostic reasoning is sound and treatment decisions are evidence-based, adhering to the implicit ethical obligation to provide competent patient care. An incorrect approach that attributes the effects to a hormone with a different synthesis or mechanism of action would represent a failure in fundamental scientific knowledge, a core competency assessed by the NBDE Part I. This could lead to misdiagnosis, inappropriate treatment, and potential harm to the patient, violating the ethical principle of non-maleficence. Similarly, an approach that conflates the actions of hormones with distinct physiological roles demonstrates a lack of understanding of endocrine system regulation, which is a critical area of dental practice where systemic health impacts oral health. This failure in knowledge, would be a direct contravention of the standards expected for licensure. The professional decision-making process for similar situations involves a systematic approach. First, thoroughly review the presented clinical or laboratory findings. Second, recall and apply knowledge of the relevant physiological systems, including hormone synthesis, secretion, and action. Third, compare and contrast the known effects of potential hormones with the observed findings. And finally, select the hormone whose profile most closely matches the evidence, ensuring diagnostic accuracy and appropriate patient management. Question 20. Compliance review shows a dental student's understanding of tooth structure requires reinforcement. Specifically, the student incorrectly identified the primary inorganic component of dentin and confused the main cellular component responsible for dentin formation with the primary cellular constituents of the dental pulp. Which of the following accurately describes the composition and structure of these tooth tissues? Option A. Dentin is primarily composed of hydroxyapatite crystals within an organic matrix of collagen fibers, and odontoblasts are the cells responsible for dentin formation, while the dental pulp contains fibroblasts, vascular elements, and nerve fibers. Option B. Cementum is primarily composed of hydroxyapatite crystals within an organic matrix of collagen fibers, and cementoblasts are the cells responsible for cementum formation, while the dental pulp contains fibroblasts, vascular elements, and nerve fibers. Option C. Dentin is primarily composed of hydroxyapatite crystals within an organic matrix of collagen fibers, and ameloblasts are the cells responsible for dentin formation, while the dental pulp contains odontoblasts, vascular elements, and nerve fibers. Option D. Enamel is primarily composed of hydroxyapatite crystals within an organic matrix of collagen fibers, and ameloblasts are the cells responsible for enamel formation, while the dental pulp contains odontoblasts, vascular elements, and nerve fibers. Correct answer is A. Dentin is primarily composed of hydroxyapatite crystals within an organic matrix of collagen fibers, and odontoblasts are the cells responsible for dentin formation, while the dental pulp contains fibroblasts, vascular elements, and nerve fibers. Explanation. Scenario analysis. This scenario presents a professional challenge related to the accurate identification and understanding of tooth structure components, specifically enamel, dentin, cementum, and pulp. A dentist must possess a thorough knowledge of these structures to diagnose conditions, plan treatment, and communicate effectively with patients and colleagues. Misidentification or misunderstanding can lead to diagnostic errors, inappropriate treatment, and potential harm to the patient. The challenge lies in applying foundational knowledge of histology and physiology to a clinical context, ensuring that the understanding of composition, structure, and cellular components directly informs clinical decision-making. Correct approach analysis. The correct approach involves accurately identifying the primary organic and inorganic components of enamel, dentin, and cementum, as well as understanding the cellular, vascular, and neural elements of the pulp. This demonstrates a fundamental grasp of dental histology and physiology, which is a core competency assessed by the NBDE Part I. This knowledge is essential for understanding the pathogenesis of dental diseases, e.g., caries progression through enamel and dentin, the rationale for various restorative procedures, e.g., bonding to enamel and dentin, and the management of pulpal issues. Adherence to this foundational knowledge is a direct reflection of the candidate's preparedness for safe and effective dental practice, aligning with the overarching goal of the NBDE to ensure competency. Incorrect approaches analysis. An incorrect approach would involve misattributing the primary mineral component of enamel, confusing the cellular components of dentin with those of pulp, or failing to recognize the vascular and neural supply of the pulp. For instance, incorrectly stating that dentin is primarily composed of hydroxyapatite, or identifying odontoblasts as the primary cells of the pulp, demonstrates a critical deficiency in foundational knowledge. Such errors would indicate a lack of understanding of the distinct histological and physiological characteristics of each tooth structure, which is a direct failure to meet the competency standards set by the NBDE. This could lead to misdiagnosis of conditions like dentin hypersensitivity or pulpal inflammation, and consequently, to inappropriate treatment planning, potentially compromising patient care and violating ethical standards of practice. Professional reasoning. Professionals should approach questions about tooth structure by systematically recalling and applying their knowledge of histology and embryology. This involves dissecting the question into its core components, identifying the specific tooth structure in question, and then recalling its defining characteristics regarding composition, cellular makeup, and functional elements. When faced with a clinical or diagnostic scenario, the professional should first identify the relevant tooth structure involved, and then consider how its properties influence the condition or treatment. This systematic approach, grounded in foundational scientific principles, ensures accurate diagnosis and effective treatment planning, thereby upholding the highest standards of patient care and professional integrity.